United States to set up for an Ebola quarantine facility in Kenya for American citizens exposed to the virus in DR Congo and Uganda have triggered public anxiety and legal battles. While U.S. officials say Kenya has already given written approval, lobby groups and health experts are now demanding full disclosure of the agreement. Stanley Nyaringita now reports.
Plans to set up a quarantine facility in Kenya for Americans exposed to Ebola in the Democratic Republic of Congo, DRC, and Uganda could face a legal setback if the High Court rules in favor of Katiba Institute, which is seeking to stop the project despite it already receiving approval from the Kenyan government. In its petition, which names the Attorney General and the Cabinet Secretary for Health as respondents, Katiba Institute argues that the proposed facility is unconstitutional. The organization is now asking the Ministry of Health to submit within 24 hours a contingency plan detailing Kenya's preparedness. The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has also criticized the Ministry of Health, accusing it of misplaced priorities for agreeing to host the facility, while local healthcare challenges remain unresolved. However, the government says it remains confident in its capacity and preparedness.
Anything that comes from an international request, it goes by the laws of Kenya. So we will not be breaking the law to have a conversation with partners, not just the US, but any other partner.
Kenyan government continues to protect the Kenyans, but as we continue to protect the Kenyans, we cannot abdicate our obligation and our duty in global health security. This is what we have been known for decades. That is why Kenya is the place where we've done malaria research. This is why Kenya is the place where more than 100 countries send cases.
This comes as the United States confirms plans to establish the facility in Kenya, according to a senior official from President Donald Trump's administration who spoke to TV47. The White House, however, maintains that while it is pursuing measures to prevent the spread of Ebola to the US, its main priority remains protecting its citizens.
Our number one obligation, we're involved in foreign policy, but even our foreign policy, the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
WHO Director General Dr. Tedros Adhanom is expected to engage public health officials in the Democratic Republic of Congo during his visit on Thursday, as the country continues to battle the Bundibugyo strain of Ebola, which currently has no approved vaccine. Stanley Nyaringita, TV47.